So I'm Blockley. I'm a project manager in the Innovation Delivery team at Kent County Council, and I am currently leading on the Technology-Enabled Care Services Build and Test project. So I'm going to just give you a bit of an overview of that project today and talk to you a bit about the aspirations and what we've been delivering since we started the project in March. So technology-enabled care is really looking at a really broad range of solutions and devices that can change the way we deliver care and support to people who are working with us and Kent residents. So the solutions are really looking at how we can improve people's independence and choice and empower them to have more choice about the way that they receive care and support. We've been a bit more innovative in our use of technology in the last couple of years during the COVID-19 pandemic. So during the pandemic, we started rolling out the car and care phone devices, for example, but we recognise that we're still only accessing quite a limited proportion of what the market has available to offer now, and actually what we've been doing historically doesn't match up with the sort of really innovative things that are available in the wider market, and we want to progress towards accessing the benefits from that wider market. So yeah, the build and test is really about looking at how we access those new and emerging technologies. We test them with the people we support, and we get an understanding of the outcomes that they can offer. So that's really what we're focusing on. And our long-term vision, as I mentioned, is really around personalising care so that we're meeting the outcomes that are important to individuals, we're enabling them to have more independence for longer and have more choice about the way that they receive their care and support. And we're also thinking about how we embed that across our care pathway. So there's an opportunity to use technology right from the beginning of people's care and support when we're looking at assessment and preventing higher levels of need. And then when they're receiving long-term care and support as well, there's an opportunity for technology to either potentially replace part of somebody's care and support package or just be an add-on to sort of improve their holistic well-being. And what we want in the long term as well is an offer that enables us to embrace new innovations as they come onto the market. So we recognise that the market is constantly changing, it's constantly sort of adding new devices and new technologies. And we don't want to just put an offer in place now that then remains static for the next few years. We want to be able to be flexible and agile as things change in that market. So that's kind of our vision statement and the outcomes that we're working towards. And this is all aligned to the Adult Social Care Reform White Paper and the aspirations that are laid out in that White Paper. And they're really about how we focus on enabling people to live in the way they want to, access their community. They feel that they're living a fulfilling life and they have access to the right aids and equipment and support to enable them to do that. They can live in their own home if that's appropriate, and that's what their aspiration is. And they have choice about how they're supported. So what is the Text Build and Test? So Build and Test is a short-term project that's running for a year that's enabling us to work with a provider to test new devices on the market and understand the outcomes that we can achieve, and then use that to inform our long-term service offer. So we started the project in March this year. We appointed NRS Healthcare as the provider, and they've been working with us on developing our offer in the East Kent area. And some of the principles that we're working within that project on are that we'll work with everyone supported by adult social care. So we didn't want to be constrained to working with a particular cohort, such as learning disability or dementia. We recognise that there's opportunities for all residents within technology. We wanted to have access to a wide range of devices, so when we look at some of the local authorities and what they have available, they're limited to quite a small catalogue, and then they're kind of trying to shoehorn people's needs into those catalogues. We wanted to have a really broad range of devices so that we can really be person-centred and think about the outcomes that are important to them and match those devices to their outcomes. We want to work with people who are newly referred into services, so they're coming to us from the front door through our area referral management unit or discharge from hospital. But we also want to take the opportunity to look at people who have maybe been receiving care and support for a long time, and there's an opportunity to relook at their care and support packages and see what we can do differently. And we want to be agile in the way that we're working and understand the outcomes very quickly. So when we know what works for us, we can scale that up. And when we find things that aren't working, we move away from that and learn the lessons and for the long term offer them. So those are kind of the guiding principles. And then, as I mentioned, the build and test is happening initially in just a small area. So we're focusing on Thanet, Dover, Folkestone and Hythe. And the reason we've selected those areas is because they're typically levels that suffer from or experience higher levels of digital deprivation. So there's a real opportunity in those areas to make an impact with the implementation of new technologies and devices for those residents. That enables us to kind of test on a smaller scale, learn the lessons, share those lessons with the rest of the county and build a foundation for culture change going forward. So whilst we are just working in East Kent initially, what we're doing as we go through the build and test project is sharing the lessons that we're learning with the rest of the county and thinking about how we feed all of that into the long-term county-wide offer. Oh, sorry. Let's have that again, so we've just been through that. Apologies. So in terms of what the technology-enabled care offer looks like, we are looking at being technology agnostic, and NRS have been fantastic in working with us in terms of scanning the whole market and enabling us to really think about all the different devices that are available from a sort of spectrum at the lower end of intervention, availability of apps and things, looking at things that might already be available in people's homes or that they already have access to and how they can use those differently. So thinking about things like using their iPads or Apple Watches or Alexa smart speakers, and then all the way up to some really sort of sophisticated systems like monitoring in people's homes that enable us to build up a pattern of people's behaviour over time and understand kind of what their day-to-day looks like. Are there opportunities to support prevention if we can identify from their day-to-day patterns of behaviour that there are actions needed to take to support them differently, for example? So we've got a really wide range of devices and access to the market working with NRS, and they're constantly sort of horizon scanning for new things that are coming onto the market and that they think we could benefit from as well. And we'll be able, with the offer, to bring those into the build and test as we go through. And then we've also got access to an apps portal through Orca, which is one of their partners. So again, that's a really broad range of apps that we can use to sort of support people with exercise or with cooking or with their well-being. So you'll know from our own day-to-day lives now that there's a huge range of apps on the market that can support with a range of health and well-being outcomes, and we can access those. The other thing that we're thinking about as we go through the build and test, it's not just the access to devices that we need, it's actually supporting culture change within our own workforce. So making sure that adult practitioners within adult social care are able to understand what's available to them, to think differently about their care and support planning and their reviews, and really embed this into their practice. So a big part of the build and test is that we're working with our OT colleagues in-house and with OT colleagues in NRS as well, and with the Digital Innovation Centre to look at what we can do in terms of culture change. So really thinking about that training and development, how we get practitioners comfortable with understanding the technology that's available and how it can meet people's outcomes. So we've been looking at lots of different channels to do this. We've had marketplace engagement events where people can come and sort of interact with the technology and try it and speak to the suppliers. We've had training sessions. We're going to have reflective practice sessions, which will give people a space to talk to one another about what they've been doing and share best practice about how it can be rolled out more widely. And then we'll also be looking at our senior management as well and how we can promote this at a strategic level. So our senior managers are already really bought in and really keen to do this, but they need to know how they can support their workforce and what the workforce is going to need to do differently in the future in order to really make this work. And hopefully all of that is going to contribute to the development of the digital first approach, which is the long-term culture change that we're working towards. So just going to talk through a couple of case studies that hopefully just bring this to life a bit and illustrate the opportunities, not necessarily even with sort of really high-end devices, but as I say, with some of the stuff that's really readily available on the market, not necessarily even through someone like NRS, but things that you can go and purchase yourself from Amazon, for example, make a real difference. So So these are our tech facilitators case studies. So Lisa is just here and can talk, if anybody's got any questions, talk to you about the work that she and her colleague Matt have been doing on their tech facilitating and supporting our practitioners to think differently already about what they can do and the opportunities. This is a really good example. Mr. A is a 32-year-old male who is living with epilepsy and recently found that his the number of seizures and the intensity of the seizures that he was experiencing were increasing. And it was having a major impact on his family life, so he was really struggling to go out and about, to support his family life, taking his daughter to school, and struggling to work. And all of those things obviously were having a real impact on his independence and then on his mental health as well. So on assessment, they were able to talk to him about what was important and get that picture that he really wanted to be a more active participant in his family life and be able to go out and regain some of that independence. They looked at what he already had in place, what was already available within the home, and he already had an iPhone. And they looked at pairing that with an Apple Watch then to see if they could meet his needs and some of the outcomes. So the Apple Watch actually has the capability to monitor heart rate, can detect falls, and has an epilepsy app available as well. So with all of those things combined with the GPS functionality as well, that was a really, really valuable tool in monitoring those seizures that he was having and then enabling, if there were any problems, enabling his family to locate him very quickly. So in this case it was as straightforward as implementing the Apple Watch, making sure he had access to that and all of the details were set up with the family members. And that really enabled him to regain some of his independence, go back out into his community and go and start collecting his child from school. So, really valuable. And then this case study is really good in just showing not all of these devices and not all of the technology that's available now is kind of based on Wi-Fi and broadband. Obviously in the county we're still going through that sort of digital switchover. We don't still necessarily have fibre broadband in parts of the county, and so I think a lot of the time that's seen as a barrier or a restriction. But this is a really, really good case study and example of where they've been able to overcome some of those challenges by being a bit more creative about the thinking. So Mr. B lives alone in a caravan in quite a rural area and lives quite an off-the-grid lifestyle. He's really happy with that. He basically lives in a big field with no support network around him, but that's obviously been of concern to his family and to social care. It started to deteriorate and the GP had referred him to social care for an assessment. But he was really, really adamant that he wanted to remain living in the way he was living and looking after his animals. So the tech facilitators were looking at what would enable him to maintain his lifestyle in his home and do so safely, but with that restriction of the Wi-Fi not being available in that rural area. Tech facilitators looked at a range of solutions, but actually came up with, again, something pretty simple, which is a big button 4G mobile phone. So it's pretty easy to use, has a big SOS button on it that enables him to utilise that and access it. And in terms of charging the phone, they just purchased a solar powered battery pack so that he could keep that phone charged and stay at home safely with the knowledge that he could access support if it was needed. So that's just been a brief run through of the project and the outcomes that we're hoping to achieve. And if anyone's got any questions, I'll just quickly talk you through, before we go to questions, what we're doing next. So we'll continue taking referrals from the build and test area in East Kent and try and understand what we've been able to achieve. And then we're feeding all of that learning into the development of the county-wide offer, which we're planning to have in place next year. We will also be, to feed into that county-wide offer, hosting a series of working groups with people with lived experience. So if you're interested in being involved in those, or if you know anyone with lived experience who might like to participate in those, we'd be really, really pleased to have them involved. This is how you can get in touch with us if you'd like to. That's me done. Thank you.
I'll just move on to
Stu, would you mind just placing that the contact page, please?
Oh, yeah.
It went really quick.
You're like picked up, yeah.
Thank you.
The wrap-up thing from Jane.
The slides will be available after the session today as well. They'll be loaded up, so all of the slides will be you'll be able to access them as well to get all the details. Okay. Sorry? Yes. Yeah.
We'll email everybody once it's all available.
And anyone who's attended today will get a link, so you can link into
Thank you.
That's fine, don't worry about it, it's fine.
Okay, good afternoon everybody. This is the next part of the presentation, although I do want to go just a step back and then I'll come back into the technology-enabled care. I'm Anna Tidmarsh. I have two roles. I'm really privileged. I'm working for the Kent and Medway NHS, the CCG, in a workforce capacity. I'm really concentrating on developing workforce for the care sector, which is really great to do. And then I'm also a director in the Digital Innovation Centre. And I'm going to tell you a little bit about our care sector workforce work. We are a very multi-agency group, fitting in with the Integrated Care Board, which is going to be launched on the 1st of July, which has health and social care together and really looking at taking things forward in Kent and Medway in a very integrated way. And I've been trying to do that for I don't know how many years, so hopefully this will move it forward. Part of the people plan and the workforce plan, which is around health and social care, there's also a real big attention for care sector workforce development. And I think those of you who work in health and care know that that's really important and is part of the overarching workforce that we have in Kent and Medway. And I'm really privileged in chairing a care sector workforce group which is developing support and workforce development for the care sector. We've got KCC, Medway commissioners and also providers. We've got Health Education England, Skills for Care. We've got primary care there, Health Education England, as I said. So it's a really wide group. And we are able to offer quite a lot for the care sector. We are funded by health or social care and are able to offer leadership development, etc., etc. Our priorities are here. There are sort of 7 key priorities. Health and well-being is, of course, a really important one after recovery in COVID. But also recruitment, as you may have all known, there's a huge workforce gap in the care sector workforce, and we're really looking at how we can recruit and take that forward. So I won't talk you through everything because we haven't got that much time. But we're bringing in the digital development as well, and that's my next slide. The only other thing I wanted to emphasize is the attention for equality, diversion, inclusion, but also personalization. And we're taking the ESTER program forward. I don't know whether anybody has heard of the ESTER program. It's very much putting the person, Esther, and that could be a man or a woman, at the centre of what we're doing, and it's what matters to Esther. And we're really keen to take that forward, and the NHS has adopted it now in a big way as well, so it's really exciting to take that forward. And the only other thing to say before I go into the digital aspect of this is that we are creating a health and care academy, which is very virtual, so it's not a school or anything, but it's bringing together on our website, and it should sit under that integrated care system, where we bring together everything that's happening around health and care in relation to education, training, workforce development. So that's a really exciting way forward. One of the key priorities in there is also the digital development and creating a workforce which is equipped to deal with digital and have digital skills and understanding. And there are already quite a lot of programs that are happening in Kent and Medway. The Innovation Delivery Team from KCC has delivered, in collaboration with the NHS, the Digital Care Home Programme, and that's very much around getting care homes connected to Wi-Fi, to understand how you use an iPad, and giving them an iPad, handing out iPads, which were funded by NHS England, and also helping them to access and use Microsoft Teams and communicate with GP surgeries. And during COVID that was even more important, but it remains important. Another program was the remote monitoring, which is going forward. That's really monitoring people's key physical functioning, but being in immediate contact with GP practices so that you prevent hospital admissions and are able to bring health and care workforce in due course. That's continuing, and that's really important that that's rolled out. It's rolled out to care homes at the moment, but the idea is that that will extend it to the whole of the care force. I'm going to talk a bit more about sort of skills improvement through technology-enabled simulation, and I'll come back to that. That's also digital. We are linked with, as Lixxy already said, with the KCC Build and Test program. I think it's Test and Build, I always do it the wrong way around. Anyway, and we're really excited from a care sector perspective, but also as a digital innovation centre, to support the training and development and to provide a space where people can actually access technologies and have a look at how technologies could work. We also are taking forward a digital leadership program in primary care and linking the care sector into that. And then we're creating more and more of a VR, virtual reality and extended reality experience, and I'll talk about that. And then the last thing is a Help to Care app that we have, and I don't know whether you know about it. It was again supported by the Innovation Delivery Team, but the Digital Innovation Centre is taking it over, and it gives advice about some of the basic healthcare tasks that people need to do, not only for carers but also for people themselves. You can see here an impression of some of the things they're offering. I am going to come back to that, but I wanted to introduce Esther there, the middle picture. Esther is one of the mannequins that we are using, and I will talk about the Digital Innovation Centre. So that was one hat that I'm wearing to look at how we can develop the care sector workforce and support. And it would be really great to have your input into that, because we can do a lot more if we work on that together. One of the things that we're wanting to do in relation to digital development, we have developed a Digital Innovation Centre. And what we want to do is to really give an innovative experience and a different way of helping people to learn and to train. We are currently sponsored by the CCG, by Paula Carr, Diabetes Trust, by Macmillan, to make sure that we can give free training to the care sector, health and care sector. And how we're doing it is that we are giving them a way of experiential learning. So we've got a whole range of areas that our clinical skills facilitator, who's a nurse, a qualified and experienced nurse, can give. And for instance, in the care sector, what people really need is wound care, diabetes care, dementia care. A lot of people will be offering this, but what we wanted to do is not to just stand in front of a classroom, which we're now doing, and putting a presentation up and giving that experience. We have got Esther, our mannequins, we've got two, and they are complete, well, they're not robots, but they are full of technology and digital technology. And they can breathe, they can talk, you can do blood tests on them, you can learn how to do injections, you can do catheter care. They look like women at the moment, but you can take the wig off and you can change the genitalia, and so you can do catheter care for men and women. And they are amazing. I would have brought one along, but they are very, very heavy, so I couldn't do that on my own. What we're doing is using the mannequins to do scenario-based training. So really to give people an experience, give a scenario and work with the mannequins and really think through how you would do wound care. But the mannequin, we've got a technologist sitting in a control room. The mannequin can talk. So if you're really rough-handed, she can say, "Oh, you're hurting me," which is quite a bit scary if you first look at it. And being social care trained, I wasn't used to it, but I know nurses and others are used to it in their training. But that is not available for community services very much, and it's not at all available for the care sector. So it gives you a really different way of learning. We have that in our Digital Innovation Centre, and we've got a care suite with cameras. We've got a studio where other people can follow the experience, and then we do a debrief. And so your learning is very much more as to how you've experienced it as a caregiver. We can also give some feedback from the control room to say how it was to experience the care that's been given, but also colleagues can comment on it and can learn together. To enhance that experience, we've got virtual reality headsets. I think she's on the slide here, yes. And putting on a headset, we can give you a feel for how it is to have dementia, to have a diabetic hypo, and also to be very frail. And our technologists are working on other scenarios, and we're really keen to bring the technology into the scenario planning. And it just makes it so different. I've always had the lead for dementia. My father had dementia, loads of people around me had dementia, so I think I know what it is to have dementia. Well, if you put your headset on, you actually can experience how disorientated it can be and how you might just not know where you're going. The same with the diabetic hypo. It's quite a scary experience if you weren't aware of that. So it helps staff, everybody, to really live it from the experience process. We're really excited to be able to offer that, and that's also an offer for the prescribers and the social workers, and clearly also for NHS colleagues, health providers and staff, to bring in the technology and to learn what we could do with the technology around scenario planning. And it's a really different way of learning. So very excited to be part of the test and build program, but also generally we want to offer this to Kent and Medway health and care providers, and hoping that it will give a completely different experience. There is no other area in the country who are offering this to care sector, so we're really proud of that. Now, the other thing that we want to do, because of course we're based in Folkestone or Hawkinge, that's not exactly in the centre of Kent and Medway, and it's very difficult for people to come and do the training in one place. We can offer face-to-face as well as virtual training at the same time, and we've done that quite a few times. But again, sometimes it's really good to be in place. We are now working on creating a mobile facility so we can go to geographic places and come to you to deliver the training. And the other thing with a mobile experience is that we want to make it the XR, the sort of extended reality, which is amazing. I don't know if you've ever tried it, but it's sort of stepping into it. So not only with your headset on, but you can actually step into a scenario and you see doctors and nurses walking around you or care staff, etc. So we're hoping that that will help understanding and learning and feeling that you're really skilled. And we're hoping that that can be taken forward in the course of this year. I think that's all I wanted to say. So thank you very much for your attention, and hoping that we're together with the test and builds that we can create that experience going forward. Very happy to take any questions. Thank you.
Brilliant, thank you, Anne.